Do you find yourself running to the bathroom all day long or waking up throughout the night to urinate? I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast, your source for evidence-based information about your sexual health and more. Today, we are talking about overactive bladder. Overactive bladder is a very common condition. In fact, it affects 16% of the world's population. That's 1 in 6 people. Despite how common it is, many people suffer in silence, embarrassed to ask for help. My goal today is to give you an in-depth discussion about overactive bladder, dispel some common myths, and help you get the information you need to get treated. What exactly is overactive bladder? Well, overactive bladder is actually a constellation of urinary symptoms. They can include 4 major symptoms. First off, urgency, where you get this sudden, strong desire to urinate that you cannot delay. You have to rush to the bathroom. And we all have some urgency, right? But this is when it becomes problematic. Like you don't have the time to wait. Otherwise, you're worried about an accident. So another symptom can sometimes be having an accident or urgency urinary incontinence, having that leakage when you have that sudden urge to urinate that you can't delay. Also, you may find yourself having frequency or going to the bathroom more than 8 times over the course of 24 hours. That is considered abnormal. And lastly, nocturia, waking up at night more than 1 time to urinate, is considered abnormal. Now, you may be listening to this and saying, well, it's just bladder symptoms. Who really cares? But the fact of the matter is that these symptoms and these issues can lead to really severe downstream consequences. And it's important to note that while these symptoms are common, that doesn't mean that they're normal. It doesn't mean that we have to accept them as our new normal unless we want to. So how does this affect people outside of their bladder? Well, certainly people who have overactive bladder find themselves knowing where every single bathroom is wherever they go. They may avoid certain activities because they're worried about having accidents. They may not go to the movies because they can't sit through a 2-hour-long movie because they're worried that they're going to not be able to make it to the bathroom in time and have an accident in the movie theater. They may find themselves avoiding social situations or avoiding their partners and avoiding intimacy altogether. This also affects work. If you can imagine that you're going to the bathroom all the time during work hours, you're not going to be very productive because every time you start working on something, you got to get up and go to the bathroom again. And the other big thing is particularly with nocturia or waking up at night. There's 2 big issues with this. One is obviously you are going to be exhausted if you wake up throughout the night, and having poor sleep is linked with so many conditions. Some of the ones I cover include low testosterone, but also it can make it be very difficult to perform activities during the day, to have memory of the things that you did or learn and reinforce things that you've learned throughout. And sleep is very, very important. And if you have certain other medical conditions, like for example, I see a lot of people with Parkinson's disease who often have overactive bladder, their symptoms will be worse of their Parkinson's because they haven't slept enough. So not only is that the issue, but the other issue is that you're waking up in a dark room in the middle of the night to go to the bathroom, which means if you don't have track lighting or lighting available, you're more likely to fall or trip over something. Now, falls become really serious in elderly patients. Now, this statistic is really sort of scary. If you fall as an elderly patient, within the next year, you have a 20% likelihood of dying because falls are not just as simple as they used to be when you're kids. When you fall, you can break things and oftentimes end up in the hospital. That immobility from when you're healing from that fracture or that break can have tremendous downstream effects on your overall mobility, your strength, and your overall resiliency to go around and move around throughout your life. That is my biggest fear, is that one of my patients is going to fall in the middle of the night. And if you want to learn more about some tips and tricks I have to avoid falling in the middle of the night, make sure you check out my YouTube channel. I have videos on waking up at night and how to sort of safely navigate that so that you don't fall as often. Now, the other big issue is that overactive bladder has a huge economic impact, meaning that it's financially expensive. Oftentimes people are buying products products like pads or diapers or bed liners, and those obviously cost money. But not only that, when they look at the estimates of cost associated with overactive bladder in the United States, it's estimated to be $66 billion a year. That's billion with a B. And that's just direct costs. That's not talking about indirect costs like missing work or decreased work productivity and how much that costs. This is why raising awareness for this problem is so crucial. Many people will be embarrassed. They won't talk to their family about it. They will suffer in silence and they will just deal with this issue. Oftentimes, doctors are not asking. They have a lot of things to cover during their primary care visits, including how's your blood pressure? How's your diabetes? Did you get your colonoscopy? All these sort of general health issues. And oftentimes, urinary symptoms don't come up unless the patient brings them up themselves. Again, that's where embarrassment and shame comes in. A lot of people struggle. And this is one of the reasons I even started this podcast and my YouTube channel and my social media was basically to help people know what these conditions are, how they can help themselves, and then make the decision whether or not they feel comfortable talking about it with their provider, but hopefully giving them the courage to do so because now they're empowered with knowledge. Okay, so now you get it, right? Overactive bladder is not just a annoying little urinary nuisance. It is a real problem with real severe consequences. I didn't even talk about depression. People with overactive bladder are 2.5 times more likely to develop depression. And depression has its own host of consequences, obviously, that are not great. So again, now you guys realize overactive bladder is a real issue that deserves real attention. Now let's talk about why it happens. So what happens during overactive bladder is that the bladder muscle will sense bladder fullness before it's completely full, leading to contractions of the bladder wall. This is what gives you urge. It's that detrusor muscle or the bladder muscle contracting. Then this, you start going to the bathroom more frequently. This then sends signals back to your brain that the bladder is smaller than it actually is, and it becomes this sort of vicious cycle. Now, why does this happen? Well, there's a number of different causes. First off, age. As you age, your bladder muscle can change, and this can lead to more incidents of overactive bladder. Also, if you have certain medical conditions, these can put you at higher risk for overactive bladder. Things like diabetes or neurologic conditions like multiple sclerosis or Parkinson's disease. In fact, people with multiple sclerosis, about 50 to 70% of them have urinary symptoms. And when you survey these patients, they're more bothered by their urinary symptoms than they are their muscular symptoms, which is pretty remarkable. Also, people with diabetes, about 25 to 40% of them have overactive bladder. So this is everywhere. Also, certain medications can make it more likely that you'll develop overactive bladder, like diuretics, which are water pills that make you make more urine. And also, if you've had pregnancy or childbirth, carrying that baby in the uterus that's right next to the bladder can create symptoms of overactive bladder. In fact, right after childbirth, almost a third of women experience overactive bladder symptoms, and some of them can persist beyond. Being overweight. Now, being overweight can also put you at higher risk. For every 5-point increase in your body mass index, your risk of OAB goes up by 10%. So we're going to talk about this later, but losing weight can actually help treat overactive bladder. Are you sick of going to the doctor only to have them talk at you for 15 minutes and leave without knowing exactly why they're prescribing you this certain medication and what exactly the next step is to take to optimize your health? Wouldn't it be great to finally find a doctor who actually listens to you, answers your questions, and doesn't rush you out the door? Well, at my practice, Rena Malik, MD, I aim to do just that. I specialize in taking care of patients who have issues with their sex lives, issues with their bladder, with their hormone health, or are having pain in their pelvic region or with sex. My goal is to give you the time and attention you deserve so you can leave with a clear understanding of your condition as well as our treatment plan that's optimized for your goals. During your visit, I'm 100% present with you for an entire hour. And after you leave, you can reach me. It is super easy to send me a message through our secure portal, and I'll get back to you within 24 to 48 hours. No questions asked, no hidden fees. Scheduling is easy. Just visit our website, renamalikmd.com/appointments. We see patients in both Irvine and Beverly Hills, California, and I see patients virtually in California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. Oh, and don't forget Texas. If you're outside these states, consider seeing me for an educational visit. I look forward to seeing you. Now, lastly, anything that causes a blockage or obstruction can lead to overactive bladder. So if the bladder is blocked, it responds by making more bladder contractions to try and get urine out. So a very common blockage in men is BPH or an enlarged prostate, and about 50% of men with BPH will have overactive bladder symptoms, the urgency, the frequency, the waking up at night, and maybe even some leakage. And lastly, smoking. Smoking increases your risk of OAB by 44%. That is a huge number. Now, smoking has chemicals in it that can irritate the bladder lining. Not only can they irritate the bladder lining, but they can actually cause the onset of bladder cancer. And so it's really important if you're smoking to try to quit. And we'll talk more about this when we talk about treatments. Now let's talk about diagnosis. So the diagnosis of overactive bladder primarily is done by a history and physical. And what that means is that you're going to go see the doctor. We're going to ask you about your symptoms. We're going to find out how often they're happening. How are they affecting your quality of life? Are you using pads or diapers? How many are you using? How is this affecting your quality of life? How much are you drinking throughout the day? And what sort of drinks are you drinking? How are your bowel habits? How is your sex life? Because oftentimes these can be interrelated. We'll also ask about your other medical conditions as well as the medications you're on, any surgeries you've had that may lead to this blockage. For example, one of the common ones is a mid-urethral sling. In women, when that becomes too tight, can lead to overactive bladder symptoms. And then we'll go on to do a physical examination. For women, this often means that we'll do a pelvic exam. And the reason for this exam is to, one, make sure there are no abnormalities that might be causing overactive bladder. Rarely we'll find something like a urethral diverticulum that may explain this issue. Also, we can assess for vaginal atrophy or thinning of the vaginal tissues, which often happens with menopause. And that lack of estrogen in the vagina can actually affect the bladder because there are estrogen receptors in the base of the bladder or the trigone. Also, we'll assess for the presence of pelvic organ prolapse, or essentially a bulge in the vagina that may be due to pressure of organs pushing down. Now, this can happen because of weak pelvic floor muscles or because of childbirth or pregnancy, but this can sometimes be associated with overactive bladder because if the bladder is coming down and stretching out, it can cause more symptoms of overactive bladder. We can also assess the pelvic floor. So oftentimes, if the pelvic floor is tense or hypertonic, as we describe it, meaning the muscles are tight and not relaxing, this can send signals to the bladder like, hey, something's off here, and then it has more bladder contractions. So sometimes learning how to relax the pelvic floor with the help of a pelvic floor physical therapist can actually improve the overactive bladder. Now, what about men? Men will typically get a prostate examination. And what am I assessing during a prostate exam? One, that's how I can also feel the pelvic floor muscles of a male. Two, I can also get a sense of the size of the prostate. Now, if you have a very large prostate, it may be valuable to then treat the reason for the overactive bladder, which is the blockage from the large prostate. And that is a different set of treatments rather than treating the overactive bladder. And sometimes we have to use treatments from both buckets. If you want to learn more about BPH, make sure you check out my prior podcast episode on enlarged prostate or BPH. I also have a number of YouTube videos on the topic as well. Usually at some point during your visit, we'll also have you give a urine sample, one, to rule out any blood in the urine, and two, to assess for any urinary tract infection. And the reason being is if you have a urinary tract infection, that could be the cause of your overactive bladder. And if you have blood in the urine, that may be a concern to work things up for bladder cancer. And if we have any concern of bladder cancer, and oftentimes that's because of blood in the urine, or if you have symptoms like this that are refractory, meaning we've tried to treat them many, many times and they continue continue to persist, then another diagnostic treatment would be a cystoscopy, which is to look in the bladder with the small camera after you use some numbing jelly and numbing fluid that can then allow us to look in the bladder and make sure there are no bladder tumors. Now, it's very rare for bladder cancer to just present with overactive bladder, but it is an important differential to make sure that we're not missing it. Another test that we'll often do in the office is called a post-void residual or a bladder ultrasound. And what that is, we'll have you urinate and we'll check to see how well you're emptying your bladder. Sometimes people will start having difficulty emptying their bladder, and this may be because maybe their bladder is getting weaker over time due to having a prolonged blockage or due to diabetes or other things. And this then can be identified by using that post-void residual and may explain some of your symptoms. You can see if, say, for example, your bladder holds 10 ounces, and usually you were emptying it all the way, but now you hold on to about 4 ounces of urine. Every time you urinate, you're leaving 4 ounces behind. So very quickly, your bladder is filling up completely. And that means that now you're going more often because you're emptying less effectively. And so we can certainly work that up further to see if we can help you empty better. And lastly, another diagnostic tool, but also actually a therapeutic tool, is a bladder diary. Now, a bladder diary is something where we'll have you write down what you're drinking, how much you're drinking, how much you're urinating, and if you experience any leakage or urgency during those episodes. And this allows us to see, are there any patterns here, and how much are you drinking, and how big are the volumes of urine, so we can get an assessment of how big your bladder is. Not only can this give us all this detail, but it can also be therapeutic in the sense that you may identify some patterns. Like you might notice that after you drink your coffee every morning, you go 4 or 5 times, and then it sort of calms down. And so you might realize, hey, it might be the coffee that I'm drinking in the morning. So now you guys know symptoms, how it affects people, what causes it, and how to diagnose it. Let's move on to probably what you're most interested in, which is treatment. So first off and foremost, there are easy things you can do at home to help treat your overactive bladder. So this is, I think, the really most important part of this podcast is learning these things you can do at home, because that may save you a trip to the doctor. And in fact, this was one of my first videos I made on YouTube, was to talk about these things, because I felt really bad for my patients. They would come see me, they would wait in the waiting room, they'd find parking in the parking garage, and finally they'd see me, and we'd start off with lifestyle issues because they had never been offered them. No one had ever talked to them about these things they could do in their life that might improve their overactive bladder. And of course, when offered that, rather than taking another medication, most people wanted to do the lifestyle changes first. So let's start. First off and foremost, watch what you drink. You don't want to drink too much, because obviously you're going to be in the bathroom a lot if you drink too much. But if you drink too little, your urine gets very concentrated. So you might look at it, it might look a little golden yellow or dark yellow or even orangish. And that means that your urine is pretty concentrated. And concentrated urine is a bladder irritant, which means that it's going to make your bladder feel irritated, so it feels the urge to go all the time. So you want to make sure sort of your urine is a lemonade yellow color, that you are urinating with the color of a lemonade yellow. And that means you're drinking enough, not too much, not too little. Next up is bladder irritants. I've made, again, a full video. One of my first videos on YouTube was about bladder irritants. These are all things that may irritate the lining of the bladder. Some of them have better human evidence than others. Some have animal evidence. But really the point is here, you can try to eliminate some of these from your diet and see if it makes a difference. Now, you don't have to eliminate all of them, and you don't have to eliminate all of them for very long. You may do a trial for 1 or 2 days and see if it makes a difference. And if it doesn't, put it back in your diet. This is not like a GI issue where you may have to eliminate it for longer periods of time. The 2 big ones that most people have issues with are caffeine and alcohol. Now, caffeine is not just coffee. It can be tea, sodas, chocolate, or energy drinks. They all have caffeine in them, and varying degrees. In fact, a Dunkin' Donuts coffee has quite a bit of caffeine in it, probably the equivalent of double the same size of regular coffee you make at home. When you drink coffee and alcohol, both of them can irritate the bladder lining, as I mentioned, making you feel more sensitive and having more bladder contractions. But also, these 2 tend to be a little bit of a diuretic, meaning that you pee out more than you put in. And this is not a strong diuretic, so you're not going to pee out a ton more, but it can exacerbate things things because you've all been there. If you have a few drinks, you find yourself peeing a lot more than how much you're actually putting in your body. And I tell people you don't have to give up anything if you don't want to, right? But if you try for a couple days and say you go down from 3 cups of coffee to 1 cup and your symptoms are a lot better, then you get to decide, do I want to drink my coffee or do I want to have my bladder issues? And we can try medications, but they're not going to be as effective in issues where you're constantly irritating your bladder. Now, the other things, some people are sensitive and some are not. So don't go crazy over this, but you can experiment. One is citrusy fruits and juices and tomato-based products. It's usually from the acid in those products. Some spicy foods for some people, artificial sweeteners, and even carbonated beverages. So all those things can irritate the bladder for some people. Next up is constipation. A lot of people are very surprised that constipation causes bladder issues, but it actually is just a matter of spacing, right? The rectum is right behind the bladder. So when it gets full with stool, it is pushing on the bladder, making it feel like there's less space. And so it's more likely to have contractions and urge. And so when you keep your rectum empty, meaning you're having regular bowel movements, those issues go away. And there's a lot of things you can do for constipation. Oftentimes I'll try fiber with my patients, making sure they're drinking enough water with it. Also trying Miralax, which you can get over the counter, or even I have a bowel recipe, which is on my YouTube channel, which includes fiber, prune juice, and applesauce. But ultimately, there's a lot of ways to help with constipation, and it's really important to manage your bowels to have better bladder symptoms. Okay, we mentioned that being overweight increases your risk of overactive bladder. When you lose about 8% of your body weight, you will significantly improve your urinary symptoms. So if you're really bothered, trying to work on weight loss can be really beneficial. And lastly, if you're smoking, you have to quit. Smoking is going to irritate your bladder, put you at higher risk for bladder cancer, lung cancer, a whole host of issues. And so please talk to your primary care doctor. We have so many tools to help you, or you can buy nicotine patches, but there's a variety of things that can help you quit if you're ready. And so get yourself in the mindset that you want to choose yourself, help future you, and stop smoking. Quick break from this episode to let you know I am so grateful that you're spending part of your day with me. I started creating content online to empower people to learn more about their bodies without needing to go see a doctor, pay a copay, wait in a waiting room, or find parking. And it has been one of the most rewarding experiences of my life. If you want to help support our mission of providing free education, please consider joining our premium membership. There you will have access to ad-free episodes, which are released early, as well as free transcripts and the opportunity to ask me anything. And these questions are answered in our monthly AMA episodes. Support the show and join today at renamalik.supercast.com. Can't wait to see you there. Next up is bladder training. So how do you do bladder training? First off, you take a survey of how often you're urinating. So maybe on average you go every hour. So I'll tell my patients, hey, for the next 3 days, you're going to go every hour on the hour. If you feel the urge to urinate before the hour, you're going to distract yourself and you're going to do Kegel exercises. They're quick flicks, essentially contracting and relaxing your pelvic floor until the urge goes away, because the urge follows a sort of normal bell shape. You get the urge and it goes up really, really high and then it comes back down. But none of us wait for it to come down. So if you distract yourself, you allow it to come down and then you can walk calmly to the bathroom. Now, after you've successfully done this for maybe 3 or 4 days, you then go to every hour and 15 minutes. And then you continue that and then you do it every hour and 30 minutes till you get to a frequency that is easy for you to live your life. And this is quite effective for some people. And so it's an easy thing that you can do at home and try working on. Obviously, I tell people to start at home because if you have accidents, at least you're not embarrassed about it. Next up is pelvic floor physical therapy. So as I mentioned, sometimes overactive bladder is caused by elevated tension in the pelvic floor muscles. So pelvic floor physical therapists can help you learn how to relax the pelvic floor. They can also help you learn how to do those quick flicks to help you sort of stave off the urge so that you have time to then get to the bathroom. So they're essentially your personal trainer for your bladder. And it can be very, very helpful. Now, taken together, all these things, if you put them all together, you can have success. 70 to 80% of people may see improvements in their urinary symptoms when they're doing all these lifestyle changes. And that's without medication. But the important thing to realize is you're not going to see results overnight. You're going to need to be consistent and patient because things take time. Your bladder will take time to adapt to all these changes you're making, and you're going to need to stick with it. You may notice like, hey, I've gotten rid of all these delicious things in my diet and my urination's back on track. But as soon as you put them back in, the symptoms are going to come back. And so it's really important to realize that this takes a real commitment. Next up is medications. Fortunately, we have a lot of medications available for patients with overactive bladder. There are two major classes. One is called anticholinergics and the other is called beta-3 agonists. Let's start with anticholinergics. These are medications which work by blocking bladder contractions. And so essentially they help improve all of these urinary symptoms because the bladder is not squeezing quite as hard or quite as much. And medications are generally around 50 to 60% effective. And most of them are all pretty much similar in terms of efficacy. Now, these medications can be taken immediate release or extended release. I generally recommend the extended release because people have less side effects with it. The issue with these medications, while they are effective, they do have side effects. So some of these side effects can include dry mouth, dry eyes, constipation, and even cognitive changes. And I'm going to talk about that a little more. But in terms of the other three symptoms, they can be up to 20% of patients can experience these side effects. So I always warn patients that these may occur. And the good news is you can stop it at any time. You don't have to wean, you don't have to taper. If you don't like the side effects, you can stop. But you do need to try them if you're tolerating them okay for a total of at least 8 to 12 weeks to see if you're having benefit. And some of these medications you may have heard of might be things like oxybutynin, tolterodine, solifenacin, trospium, and they all have brand names as well. But essentially, these medications all have been studied rigorously in these very large studies looking at anticholinergics and dementia. And what they found is that people who take these medications for over 3 years are more likely to have dementia. This is not a causation, but it's a correlation, meaning that these medications are more often taken in patients who then develop dementia. Knowing this, I tend to try to avoid prescribing these as much as possible. However, sometimes they're the only things that insurances cover, and they are the cheapest medications available. Now, let's move on to beta-3 agonists. These work a little bit differently. These work by relaxing the bladder wall. And so they do, again, have the same sort of outcome. They have less urgency, less urge incontinence, less frequency, less waking up at night. And they're pretty much similar in efficacy. There's been no true head-to-head trials, but they've looked at them sort of side by side. And the studies were not powered to compare them, but they look pretty similar in terms of efficacy. There's two main medications, mirabegron and vibegron. They're both still brand names, so oftentimes they can be quite costly and not covered by insurance. So mirabegron has a side effect of high blood pressure. And it's not very remarkable in the studies. It was only a 10 millimeter of mercury increase in blood pressure. However, it still can be seen in patients, and so you do need to be careful about that. It also has some interactions with medications like metoprolol, for example, which may require some dose adjustment. Now, both of these medications have the side effect of nasopharyngitis or inflammation of the nasopharynx. And so typically I'll tell patients, you'll know if you have this side effect and we can stop the medication. Now, again, similar to anticholinergics, you need to try these for 8 to 12 weeks to see full effect. That doesn't mean you're going to see no effect before then, but it will continue to improve for at least up to 12 weeks. So really valuable to stick it out and try it if you're not having side effects. Now, if medications don't work, there are some what we call third line therapies. And these include Botox, sacral neuromodulation, and posterior tibial nerve stimulation. We're going to go over all of them. First off, bladder Botox. So bladder Botox essentially is Botox, which is injected into the bladder wall through a procedure. So remember I talked about cystoscopy earlier? We use a cystoscope and we use a needle inside that cystoscope to administer Botox into the wall of the bladder. Of course, this is after numbing medication, and so most people tolerate it pretty well in the office, and it's done on average once every 6 to 9 months because it'll wear off. And so how this works is just like it does on people's faces. It paralyzes muscle movement so you can't see wrinkles. Similarly, it paralyzes muscles in the bladder so they don't contract so strongly. And it's effective in about 80% of people who use it, which is really great. Now, the downsides are, of course, it's a procedure that has to be done and has to be done relatively frequently, every 6 to 9 months. And in 5% of people, it can cause incomplete bladder emptying or urinary retention, meaning that you may have difficulty emptying or not be able to empty your bladder because the Botox worked too well, in which case we'll typically teach you how to catheterize yourself or put a catheter into the bladder to help empty. Now, this is rare, 5%, but if it happens to you, it happens to you. It doesn't matter 5%, it's 100% for you, and so you need to be aware of that. Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to renamalicmd.com/morepleasure to download it for free today. Next up is sacral neuromodulation, and this is essentially like a bladder pacemaker. We implant a tined lead next to the nerve root that stimulates the bladder, and this is attached to a battery. And it typically is a two-staged either surgery or procedure. On the first stage, we'll either implant the tined lead or a temporary lead that's attached to a battery that you wear on the outside for 1 to 2 weeks, depending on how it's done. And you get to test it out and see if it actually improves your symptoms. If you see an improvement in your symptoms of 50% or more, you then go on to have the full implantation. The nice part is you get this trial period. Now, once it's implanted, people will see, again, about an 80% success rate in terms of symptom relief. But it's attached to a battery, and that battery life is about 10 to 15 years on average, which means that you will have to go back to surgery to get it replaced. Also, there are some risks, of course, with surgery, like a small risk of infection, bleeding, injury to surrounding structures, but the large majority of people tolerate this procedure really, really well. The major issue is that sometimes people may have some unwanted stimulation, which is uncomfortable, but usually that's very short-lived, and you can control it because you have a controller to help manage the pacemaker. And you don't have to really do anything with it day to day. It's only if you start having any change in your symptoms or some discomfort when you actually have to use the controller. Otherwise, it's just working all the time in the background and you don't even really notice it. And so there are also new versions of this that are coming out to market that don't have a battery. And instead of a battery, you wear like a specialized undergarment that helps turn on the lead. And so it's turned on for a certain amount of time every day rather than having a battery itself. So we'll see how well people do with that. It's still pretty early. And then there's also posterior tibial nerve stimulation. And this is essentially when a really thin, almost like acupuncture needle is put in the ankle to stimulate the posterior tibial nerve. Now, the posterior tibial nerve tracks all the way back up to that nerve root that stimulates the bladder. And so by stimulating it, it can improve these urinary symptoms. Now, it's not as effective in terms of improving symptoms as the bladder pacemaker, but it's still about 60 to 70% effective. Now, what you have to do is you have that little needle attached to a stimulator on the outside for 30 minutes, once a week for 12 weeks. And then there's some maintenance, usually around once a month after that, to help improve your urinary symptoms. Now, it's pretty safe and there's very few contraindications. I used to joke with my patients that the only real risk is that you could get into a car accident on your way to the office because you're coming so frequently. And so it is pretty time intensive. There are now implantable options for this. I've used one called eCoin in the past, which is basically the size of a nickel, and it's implanted in the ankle that also has a battery as well as a stimulator. So it stimulates on its own once a week for about 18 weeks, and then after that goes into maintenance. And the battery lasts about 3 to 5 years. that's also about 70% effective. So pretty nice outcome. I've only done a couple, but they did seem to work pretty well. The other option is essentially an implantable lead into the ankle that stimulates that nerve, again, using a lead as well. And so sort of exciting that there are these options that are coming available, and should hopefully be available quite readily for patients to choose and find what works for them. Now, lastly, if you are in dire straits and like nothing's working and your quality of life is miserable, then we do have surgical options. One of these is called a bladder augmentation or augmentation cystoplasty, where essentially we do an abdominal surgery. It can be done robotically or through a midline incision in the abdomen, where we take a piece of intestine and sew it on top of the bladder so that the bladder becomes much larger in size. Now, this is a major reconstructive surgery, so it's important to talk to your doctor about the risks and benefits, and also, go to someone who does a lot of these operations because it is very complex. The other option is to get what's called a urinary diversion, which is essentially having your urine now diverted to a bag outside your belly. And so now your urine comes out of a stoma or an opening on your belly into a bag that you empty. And honestly, for some people, this can be a huge lifesaver because you're no longer dealing with urine leakage all over your groin and your genitals and all the irritation and rashes and things that go along with it. And lastly, you could do what's called a suprapubic tube. So it's a catheter that goes in through the lower part of the belly that's implanted there that then drains urine. Now, this is a really minor procedure and it can be reversed. So it could be a reasonable option for somebody who's just really struggling with leakage and issues of leakage to help them with having less leakage. It will not necessarily always completely get rid of the leakage, but it will certainly reduce it. So we covered a lot of ground today. And what I want you to take away from this episode is that OAB is common. It's pretty easily diagnosed and it is treatable. You do not have to suffer in silence. There's a host of treatment options available that can improve symptoms for about 70 to 80% of people. And so really, if you are struggling, I encourage you to talk to your doctor, make an appointment with a urologist if you can, to understand the multitude of options available to you and get to work on improving your quality of life, because it matters and you deserve to have a good quality of life. Thank you so much for joining me today. If you guys are enjoying this content, please do me a favor and take a screenshot and put it on social media. Let me know what your favorite part of this episode was, what you learned, and what you want to see on the podcast, because it helps me see that you guys are enjoying it, and then all this work I'm doing in this solo room by myself actually makes a difference for people. And as always, remember to take care of yourself because you're worth it.